This evening, somewhere, someone is ignoring a symptom. A headache blamed on stress, blurred vision blamed on tiredness, chest discomfort dismissed as gas, a body whispering quietly while life continues loudly around it. Medicine is fascinating because the human body rarely fails without warning. It hints, it nudges, it negotiates for attention long before it demands it. And yet, modern life has become incredibly skilled at drowning out those warnings. We scroll through exhaustion, we medicate stress, we normalize burnout, we postpone checkups while promising ourselves we will deal with it later, until later suddenly becomes urgent. Let's listen more carefully to what the body has been trying to say all along. Good evening and welcome to CNC3's Ask the Doctor, where health is more than prescriptions and procedures. It is the story of how we live, how we struggle, and how we heal. We're also streaming live on Facebook and the CNC3 website. Don't forget to like our Ask the Doctor page and follow my articles in Friday's Trinidad Guardian, with a new We Health column every Tuesday, where your burning questions will be answered. But as usual, let's start with the doctor's capsule. This week, there were striking scenes outside the Seventh-day Adventist Hospital, which captured national attention, as hundreds of people gathered for a free cataract surgery outreach program. The images were powerful. There were elderly patients waiting patiently in chairs, relatives guiding parents and grandparents through huge crowds and long lines forming for one of the most successful operations in modern medicine. Now, when we talk about that problem, it occurs when the natural lens of the eye gradually becomes cloudy. Some of the symptoms of cataracts include a slowly fading vision, colors lose brightness, night driving becomes difficult, reading becomes frustrating, and many patients adapt quietly for years before finally seeking help. What makes cataract surgery remarkable is how dramatically it can restore quality of life. Patients often describe colors appearing brighter almost immediately after surgery. Some regain independence, confidence, and mobility within days. Now, while the outreach program deserves praise, the large turnout also raised difficult questions about healthcare access locally. Why was that demand so enormous? How many patients are currently waiting for cataract surgery nationally? How many elderly citizens are quietly living with avoidable visual disability while waiting months or years for care? So it argues that waiting lists are not merely administrative problems. Remember that poor vision affects independence, increases fall risk, limits mobility, and the truth is, if you can't see well, it's going to gradually isolate you from daily life. So it's important to remember we're not criticizing healthcare workers. Trinidad and Tobago has excellent ophthalmologists performing modern cataract surgery with excellent outcomes, like Dr. Neela Ramdas. The issue may be less about expertise and more about access in terms of organization and capacity, so resources within the healthcare system. There are also important practical questions about such a large-scale surgical outreach program, including long-term follow-up, because these patients now have to join an eye clinic if they're not already there, and the management of complications. I hope an audit will be done by the Ministry of Health. Cataract surgery is extremely safe, but continuity of care remains essential. But you know what's the most moving aspect of that story? Was those crowds revealed hope. Despite frustrations with healthcare systems, people still believe that health is possible. They'll wake before dawn, they'll stand in long lines, and continue to wait patiently if they believe there is a genuine chance their lives may improve. Sight is not merely vision. It is independence, dignity, and connection to the world around us. Further afield, a major new report published in the British Medical Journal is warning that the world may be less prepared for future pandemics and infectious disease emergencies, despite the lessons of COVID-19. There was a report from the Global Preparedness Monitoring Board, which says that outbreaks such as Ebola, hantavirus, and Mpox, formerly monkeypox, are becoming more frequent, and in some cases, as we're seeing in parts of Africa, more severe. According to the report, the WHO detected nearly twice as many health emergency events in 2024 compared to 2015. So experts say that while infectious diseases overall had been declining globally for years, the number of large-scale health emergencies is now increasing. The report points to several worrying trends. There is growing distrust in governments and scientific institutions. We know that, with naming, blaming, and shaming during COVID. Increasing attacks on science, political division, and worsening global inequality with respect to vaccines, diagnostics, and treatments. And one striking concern is that some poorer countries continue to receive vaccines and treatments far later than wealthier nations during outbreaks. So you remember Mpox and monkeypox, those vaccines reached some low-income countries almost 2 years after the outbreak was declared. So it's important to remember that trust and equity are two of the foundations of effective pandemic preparedness, and those are eroding globally. The report also highlights the current Ebola outbreak in Central Africa, which has already killed more than 130 people and involves a strain for which there is no approved vaccine. So the challenge is no longer simply preventing outbreaks, it is maintaining public trust during them. COVID-19 changed not only healthcare systems, but the psychology of public health itself. So there must be stronger international cooperation, fair access to vaccines and treatments, and of course, better long-term preparedness, financing before the next major health emergency arrives. And there's one lesson medicine keeps relearning. We spoke about it last week when we discussed hantavirus. Viruses do not wait for the world to become organized. There was a major study in the New England Journal of Medicine which suggested that avoiding 5 classic cardiovascular risk factors by the age of 50 could add more than 10 years of a healthy life. So they analyzed data from more than 2 million people across 39 countries and found that 5 major risk factors continue to dominate the health of your heart and blood vessels: high blood pressure, high cholesterol, diabetes, smoking, and increasing body weight or obesity. Those findings were striking. Women who reached the age of 50 without those risk factors lived perhaps 14 additional years free from heart disease, compared to women who had all 5 risk factors when they were younger. Men gained nearly 12 additional years if you did not have any of those risk factors. So the study also found something encouraging. It is never too late to improve risk. We talk about healthy lifestyles as a theme for Ask the Doctor. People who controlled high blood pressure between the ages of 55 and 60 gained the greatest number of additional years free from cardiovascular disease. We know hypertension is the single most important preventable cause of premature death. There was World Hypertension Day on May 17th, and it's a silent killer. But meanwhile, stopping smoking during midlife produced the largest gains in overall survival. So the message was clear. Small risk factors accumulate silently over decades, but modifying them even later in life still has major benefits. So it's never too late to start healthy living. And that study was another reminder that heart disease often develops insidiously, long before symptoms appear. So while medicine continues to advance dramatically, many of the most powerful interventions remain surprisingly familiar. Better blood pressure control, healthier weight, smoking cessation, diabetes management, and healthier lifestyles. Because sometimes the greatest breakthroughs in medicine are not futuristic at all. They're the things we already know, but struggle consistently to do. It's time for a short break, and when we return, it's the Kiddies capsule. Stay with us.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
70% of your immune system resides in your gastrointestinal tract.
Don't let digestive discomfort hold you back. Take control of your health with Probiotic XL. Hurry! Available only while stocks last. Don't miss out on feeling better now.
Step into ABC Doors and Windows, where quality meets variety. Discover premium wooden, steel panel, fiberglass, and steel security doors alongside aluminum, UPVC, and steel windows designed for strength and durability. At ABC, we're always a better choice, delivering products built to last and service you can rely on. Visit our showroom at 1 Chanka Trace, El Socorro South, or call 638-7184 to make your dream home a reality.
Love eating spicy food, but soon after, that familiar discomfort begins. Heartburn, acid reflux, and bloating. Introducing Peptica Gel, formulated with aluminum hydroxide, magnesium hydroxide, and simethicone to help neutralize excess acid. It's sugar-free with no chalky aftertaste and a pleasant orange flavor. Peptica Gel works fast to relieve heartburn, acid reflux, gas, and bloating, so you can feel comfortable again and get back to enjoying life. Peptica Gel, get the relief you need today. Available at pharmacies nationwide.
Welcome back to CNC3's Ask the Doctor. Children have a wonderful way of making health advice sound simpler, kinder, and somehow much wiser than adults do. They remind us to drink water, wash hands, eat properly, play outside, and sometimes even go to bed on time, which frankly many grown-ups still struggle to accomplish. It's time now for one of the most joyful parts of the program, the Kiddies capsule, where the smallest voices often deliver the biggest lessons. Here are our little stars this evening.
Did you know that the month of May is also recognized as National Physical Fitness and Sports Month? This month highlights the importance of staying active and making movement a regular part of daily life. Physical activity is essential for maintaining good health as it strengthens the body, improves heart health, and helps prevent illnesses such as obesity, diabetes, and high blood pressure. It is also closely linked to your mental well-being as it helps reduce stress, improve mood, and increase energy levels. Participating in sports and exercise can also improve your ability to work in teams, boost confidence, and build discipline. By staying active each day, you can improve both your physical and mental health, leading to a stronger, healthier, and more balanced you. I am Renisha Dindial from Saraswati Girls Hindu College, and this is your Kiddies capsule.
Good evening, everyone. I'm sure by now you know that the month of May focuses on mental health awareness. Mental health is often overlooked, but it plays a major role in how we think, feel, and function. It doesn't care how old you are, how strong you may look, and how put together your life may seem. Kids feel it, adults feel it, and even the people who swear they're fine 24/7 feel it. anxiety, stress, burnout, loneliness. It all silently creeps up on you like a background noise you didn't even realize was getting louder. But here's the truth. Checking in on your mind is just as important as checking in on your body. Talking about it does not make you weak. It makes you human. So be mindful when checking in on your friends and make sure they're really okay. And don't be afraid to be honest when someone asks you well. Your mind matters always. I am Gabriella Ramsamuch from Saraswati Girls Hindu College, and this is your Kiddies Capsule.
Hello, my name is Vincent, and today I want to talk about the importance of making time for a laugh. Yes, a laugh. During stressful periods, the body releases a hormone called cortisol. Cortisol helps the body respond to stress, but when stress continues for long periods, cortisol levels can remain too high and negatively affect health and mood. Research shows that laughter helps activate relaxation responses in the body, which helps lower cortisol levels and improve mood. Taking time to laugh and enjoy positive moments with family and friends is not only fun, but also supports better physical and mental health. So go on out there and have fun, because a little laughter is very important and healthy for the body and mind. That was your Kiddies Capsule. Have a great night.
And we say a special thank you for those pearls of wisdom. It was a particularly insightful capsule this evening. And it's time for a short break. When we return, the Medical Minds segment awaits.
My name is Kyron Pollard, and I approve this message.
World-renowned cricketer Kyron Pollard.
I've been playing cricket for most of my life, and I don't know what it feels like to wake up and not be sore. If Omega XL works for me, it will work for you.
Don't let pain stop you from living your life. Chronic inflammation equals pain and disease. Reduce inflammation, reduce pain.
Omega XL can empower you to keep doing what you love. Don't let joint discomfort hold you back.
Live long, stay strong with the XL brand.
Visit your local pharmacy or health food store today.
Magical Expressions Limited is the largest local importer and distributor of fresh cut stems, offering the widest range of beautiful flowers at the most affordable prices. Call us today at 701-6488 or visit our website to order.
Only BioStrath gives your body more than 60 of the essential nutrients it needs every day in a product that's 100% natural for stronger immunity, enhanced focus, increased energy and stamina. BioStrath. Get what you need naturally.
Eye care tips for Seaview Optical. Eat well. Good eye health starts with the food on your plate. Nutrients like omega-3 fatty acids, lutein, zinc, and vitamin C and E might help ward off age-related vision problems. Quit smoking. Makes you more likely to get cataracts, damage to your optic nerve, and macular degeneration. If you have tried to kick the habit before only to start again, keep at it. Wear sunglasses. The right pair of shades will help protect your eyes from the sun's ultraviolet UV rays. Use safety eyewear. If you use hazardous or airborne materials on the job or at home, wear safety glasses or protective goggles. In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
Folks, take a look at all these medical conditions. What does it have in common? This, ITIS. But what does ITIS really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
ITIS really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
Welcome back to the #1 show for news, views, and interviews of all things medical. Dr. Nadia Watson is a palliative and family care physician who whose work really sits at the intersection of science and compassion as she guides patients and families through serious illness with clarity, courage, and grace. This evening, she discusses that silent killer of hypertension in our medical minds.
This is Dr. Nadia Watson with another top tip, and today I'm stealing a line I read in an article by Dr. Joel Tilak Singh. It was an article about high blood pressure, and the first line was, "What if feeling fine meant nothing?" And what that powerful sentence means is that many of you all are walking around with diabetes and high blood pressure, but we're focusing on the high blood pressure, and you all have no idea, and all you're feeling fine. Meanwhile, your blood pressure going up, so you're having damage to your vessels, as your blood vessels, you're damaging your kidney, you're damaging your heart, and you ain't know nothing because you're not checking up on it. And it have some people that know that they have high blood pressure, but they don't take the tablets because they take the pressure yesterday and it was good. But not understanding that your blood pressure fluctuates throughout the day. So if you take it at 8 o'clock and it's good, by 10 o'clock in the night, we call that the twilight hour, like around 2 o'clock in the morning, that kind of hour, that's when all them heart attack and stroke just come into the hospital. I know because I worked there for quite a while, because your blood pressure good and you're feeling fine, everybody's feeling fine. So that little sentence there, if all you're not too sure, if all you have high blood pressure or even diabetes, go and check on your doctor. And if you have high blood pressure but you just take your tablet only when you get a headache or only when your pressure high because you checked it last week and it was good. All this time you feeling fine, but you ain't good because everything else been affected. We will see it again. Your heart, your kidneys, your blood vessels, and the first time you'll ever know that you have high blood pressure is when you get the first stroke or the first heart attack. So don't let that be you. All right, so go and check your doctor, okay? So I'll be safe and take care.
And we say a special thank you to Dr. Watson, and you can get more of her top tips at a Healthy Living Medical Practice on Facebook. And once more, we say thank you for her love, service, and support. No stranger to the Ask the Doctor family. Now it's time to put your medical knowledge to the test, and our wonderful audience members are ready to take on the challenge. The giveaway segment with the compliments of Great Health Works is coming up next.
Looking for a completely natural way to supplement your family's diet? Only BioStrath gives your body more than 60 of the essential nutrients it needs every day in a product that's 100% natural, so it's more easily absorbed. For stronger immunity, enhanced focus, increased energy and stamina, and faster recovery. BioStrath, get what you need naturally.
Food Basket Marketplace, Arima, Shogwana, Shafle, and Goville. Everyday low prices. Clean and white bleach, 950 ml, $15. Blue Waters Cran Water, 1 liter, 2 for $15. Hibiscus all-purpose flour, 2 kilograms for $15. Box May cornmeal, 340 grams, $15. From fresh produce to pantry essentials and household items, visit Food Basket Marketplace, Arima, Shogwana, Shafle, and Goville. Food Basket Marketplace, where shopping is a pleasure and the price is right.
A healthy cardiovascular system isn't just about adding years to your life. It's about adding life to your years.
Without it, I don't feel good. I must have it each and every day.
Heart XL, formerly known as Strong Heart, available nationwide.
Things don't always go as expected. Be ready with Trinry for auto, home, business and group life. Call us at 800-TRIN or visit trinry.com today. Huge insurance premium. Pay your premiums bit by bit with FlexiPay from Trinry. For more manageable auto, home and commercial insurance payments, call us at 800-TRIN or visit trinry.com today. Trinry, premier insurance coverage for less.
Welcome back to CNC3's Ask the Doctor. As a reminder, we're live on Thursdays with a rerun on Friday at 11 a.m. or Saturday at 11:30 a.m. So it's giveaway time. A special hello to Joseph Sandel and the rest of his brilliant team at Great Health Works. So the number's on the screen, and as a reminder, when you're patched into the studio, listen on your telephone rather than the TV set, because there is a delay that creates confusion. Our friend Uncle Rajiv Surat Singh is waiting to hear from you. And of course, feel free to send in even videos of school-age children for the Kiddies capsule. He's in charge as well too in the giveaways and the call-in segments. So, our question this evening has an ears, nose and throat flavor. What surgery that's often called a nose job, in inverted commas, can also treat conditions like a deviated septum, perhaps due to trauma or born with changes to that septum? I'll give you a hint. It starts with an R. What surgery, often called a nose job? Hello. Welcome to Ask the Doctor. You're on the air. Hello. Welcome to Ask the Doctor. It's the giveaway segment. Do you have an answer? It sounds like we lost that call. So as a reminder, listen on your telephone, not the TV set. I know you don't want to miss a second of your show. So tell me, starting with the letter R, what's the medical term for that procedure? Good evening. Hello? Welcome to Ask the Doctor. You're on the air.
Who's talking to me?
Welcome to Ask the Doctor.
Hello?
We're hearing you loud and clear. Good evening,
I'm not hearing you, but is the answer rhinoplasty?
That is indeed the correct answer, and I hope that you're hearing us now. Congratulations.
I can't
You're a
hear
winner.
you.
Rhinoplasty is indeed a medical term. Congratulations, and stay on the line because we want to take some of your personal information off the air. Wow. So, well done. Rhinoplasty, not just used in cosmesis, but also in the surgical treatment for problems such as a deviated nose bridge or nasal septum. Now it's time for a short break, and when we return, there'll be more of your questions and hopefully answers as the open forum comes up.
Folks, take a look at all these medical conditions. What does it have in common? This, itis. But what does itis really mean?
The suffix itis denotes inflammation of a specified organ or tissue.
Itis really means inflammation. How do we combat chronic inflammation? Through lifestyle changes. Then, and only then, make sure you're getting enough omega-3 fatty acids.
Always consult a qualified medical professional before starting any supplements.
In every room, Vision sets the standard. For a limited time only, get your progressive transition lenses with an anti-reflective coating, designer frames, and eye exams. Starting at $16.50, only at Seaview Optical. Affordable eye care for everyone.
What if we each took one small action today that could have big impact tomorrow? What if one family took a stance to reduce waste in our landfills? What if one school made a choice that could lead to a greener Trinidad and Tobago? When you recycle glass, you create jobs, reduce waste, save resources, and help preserve our environment. Glass bottles and jars are 100% recyclable and can be reused indefinitely. Recycle your glass and join the Glass Loop movement today.
Attention all listeners, are you ready for the ultimate news experience? Introducing the Trinidad and Tobago Guardian, the nation's first and most subscribed newspaper. We deliver where others can't. With the widest delivery network in TNT, you can have the Guardian delivered right to your doorstep or office every single day. Take advantage of our special annual subscription offer so you can stay on top of the leading stories even when you're on the go. Sign up today. Time is running out. Inquire about our 3-month and 6-month packages as well.
Each day I ask myself, how can our country be better than it was yesterday? We all hope for a better society, but not many understand the power of their influence to change the world around them. A small act of kindness holds as much power as a camera, a mic, or even a seat in the parliament when it comes to achieving societal development. I understand that my purpose extends beyond being a mere observer. I am an active participant in shaping the world around me. From the stories I write to the newscast I produce, it is my hope that everyone is heard and understood. We are where you are.
Welcome back to CNC3's Ask the Doctor. It's time for the open forum with questions of a medical nature. We'd love to hear from you. And as a reminder, listen on your telephone rather than the TV set, because that delay creates confusion. As we head to South Trinidad, as San Fernando is on the line, thank you for waiting and good evening. Oops, sounds like we lost that call. Hello. Right, so, but the numbers on the screen, the phone line's already burning up. And we would love to hear from you. So this is your opportunity to call in. We know that we were speaking about hypertension, and indeed it was alluded to in the medical minds about the fact that these numbers often rise. It could be a very insidious problem, but with devastating complications. The eyes, the brain, the heart, kidneys, and blood vessels. And we're trying to get your blood pressure under 130/80 millimeters of mercury for most of the world. Of course, the gold standard may be less than 120/80 millimeters of mercury. And that is in, of course, conjunction with your doctor or pharmacist, your diet, exercise, weight loss, and medications if warranted. And of course, we're doing blood investigations to monitor not just your blood pressure, but also issues like sugar, cholesterol, and so many of those chronic, non-communicable diseases. As we stay in the Southland, as Princestown is next up, good evening. Welcome to our show. Hello.
Good evening, Doctor.
Thank you for joining us, sir. You're opening the batting on the open forum. Welcome.
Yes, Doctor. I appreciate some of the comments in your first salvo.
Yes, sir.
Yes, Doctor. I said I listened to your opening salvo, and I made note of some of the chronic disease. My question is sort of a stupid question, really. Sometimes you go to the drugstore with a prescription for a prescribed drug. Most times they tell you they don't have the original drug, but they have the generic drug. I want to know what are the advantages and disadvantages of the original drug, the genuine drug, and the generic drug
options.
And
yes.
Sometimes they even recommend a herbal treatment for you. So, Doc, I will listen off the air to your explanation on that.
And thank you so much for taking the time to call in, because it's a very insightful question and relevant in today's world because of the astronomical and burgeoning costs associated with healthcare. And when we're speaking about a particular agent or medication, you're looking at safety, tolerability, the efficacy of that agent, and of course at an appropriate cost. And it is very difficult for most healthcare systems in the world to manage only original drugs as part of the formulary. That is why the CDAP, or even within the hospital and health centers, you may find, because of the large number of tablets which would be required for, let's say, diabetes, and the quintessential drug in type 2 diabetes is metformin. And the government may perhaps have to buy millions of tablets of metformin during a specific period of time. So it must be done at an appropriate cost, of course, ensuring that the safety must be paramount, the tolerability by patients, and it must be effective. You don't want to be on a drug that will not work. Now, it has been said that some generics would be better than others. There are some parts of India, Germany, or Canada. Many of those drugs have formed a part of the shelves in this country. Sometimes the molecules are less stable, or the way that they are assimilated in the body may vary. But have a chat with your doctor or pharmacist about the excellent generic options which are available. I'm a fan of such. So although sometimes you may find that patients would prefer to use a drug which would be prescribed as the original title, but as a result of cost, or even if we think that it comes from an excellent company, the use of those medications are very much on the cards, particularly in today's world of medicine. So the way that these drugs are stored, of course, are important. You want to ensure that they're not exposed to direct heat, the molecular structure, where they are made, but ensuring that you are looking at your goals. So you're looking at perhaps an A1C if you're a person with diabetes using a generic drug. You're looking at your blood pressure to ensure that you are getting to targets, cholesterol levels. So this is an opportunity to bring perhaps the health economic idea into the front burner, because it is a very real part of modern medicine. And thank you, it's a superb question. Have a chat with your healthcare provider about which ones would be appropriate for you. And don't be embarrassed to switch, because many of these will have similar or identical outcomes to the original option. In terms of herbal treatments, be wary that because a drug is herbal, it does not necessarily equate to being safe. Sometimes there may be adverse effects, and perhaps these drugs have not undergone rigorous clinical trials to ensure that they will be effective. And there may be interactions with drugs prescribed by a physician. So that too could be part of the clinical encounter when you see your healthcare professional. Our next caller hails from Arima. Good evening and welcome to Ask the Doctor.
Good evening, Doctor. I just wanted to say that I've been waiting for this part of your program, and I would like to suggest to the government that in terms of the eye care,
yes,
we have 5 hospitals in Trinidad and Tobago, and people can be zoomed so that the amount of patients that have to go to cataract, and even there are many people that go to the eye clinic every day, which is like 150 to 200 persons a day. It's usually tired out the staff, right?
Yes.
It's about time we zone the eye clinic so that what is taking place at the hospital,
yes,
with the foreigners, wouldn't be happening. They would not have had to import these doctors into Trinidad and Tobago because they are qualified people, right? So I think somebody from the ministry is listening.
Very insightful observation. Thank you. Yes, very insightful statement that we need to deal with the burden associated with perhaps the commonest surgical procedure in the world. How are we going to whittle down some of the waiting lists associated with persons due for cataract surgery? Thank you very much for being part of our program. And I want to emphasize that we need an audit from the Ministry of Health, not just to look at reasons and how it can be improved within the various regional health authorities, but also to ensure the waiting times are whittled down or shortened, and also to ensure that when these projects occur, appropriate follow-up is maintained, because these individuals who have had surgery done will need to now join these already overburdened clinics. So if they're not already part of the program, they need to get eye drops, they need to be followed up, perhaps there may be the odd complications such as infections. So this could also lead to rising health costs and also worsen the already long waiting times within the public sector. Arima is on the line again. Good evening. Welcome to our show.
Good evening, Doc.
Thank you for being part of our program.
Thank you. You're welcome. Okay, my question is,
yes, ma'am.
Can you explain in simple terms why OP the grill by sulfate will be prescribed for someone. I don't know if I pronounce the word correctly.
But the last part of your question was muffled. Can you repeat it for me?
By sulfate.
Clopidogrel bisulfate. Clopidogrel, absolutely.
Clopidogrel.
Yes, ma'am.
Bisulfate.
Yes.
Why? If you could explain in simple terms, why it will be prescribed for someone.
Thank you very much for that excellent question, and it would be a pleasure and honor to do so. So, clopidogrel has become actually a part of CDAP recently. So, it is an antiplatelet drug. So we know that platelets are found in the bloodstream involved with blood clotting, and the classic anti-inflammatory, antiplatelet drug would be aspirin, as we know in patients who have had heart disease or strokes, if they've had blockages to the arteries, in order to thin the blood, to use a vernacular term. And clopidogrel, which is the generic name to another drug, acts in a different pathway to ensure that your blood is thin, in inverted commas, so it is another blood thinner. So we know about aspirin, and it may be used in conjunction with this to ensure persons who are admitted to hospital with chest pain, shortness of breath, if you've had a heart attack, or if there are blockages, that term is angina, and it may be associated with nausea, vomiting, sweating, shortness of breath. Some people, of course, may have side effects, because if you're on aspirin and clopidogrel, there is an increased risk for bleeding. So doctors may sometimes prescribe a drug to reduce the production of stomach acid to prevent bleeding. There may be interactions with some of these drugs that lower the efficacy of clopidogrel. And sometimes another antiplatelet drug is used instead. So the indication for this drug is with respect to blockages in the arteries. Whether you have angina, if you've had a history of a heart attack, and subsequently further testing entailed a wire or a tube called a stent to open the arteries, it would be mandatory that you use two of those drugs, such as aspirin and clopidogrel, for a period of time for perhaps 6 to 12 months. And if you have had a stroke for a certain period of time, 21 days after a blockage in the artery to the brain, the doctors would recommend using both aspirin and clopidogrel. The downside would be the increased risk for bleeding, but it's a commonly used agent, and perhaps 1 year or more after a heart attack, admission to hospital, you should be on both medications, unless, of course, there is bleeding or a reason for you not to do so. The phone lines are burning up. Good evening and welcome to the open forum of Ask the Doctor. You're on the air.
Hello.
Hello.
Oh, yes, this is Arena calling back.
Yes, ma'am.
I'm not sure if there's a department in the Ministry of Health that does research regarding herbs. But herbs are made for healing.
But regarding herbal treatments?
Yes, herbal treatment. And it do work.
Yes.
You just need to,
absolutely.
do the research.
Properly analyzed and used. Yes. Thank you very much. Thank you very much. And indeed, the Food and Drug Administration, especially when these drugs are marketed prior to use on the pharmacy shelves or the use within a healthcare or hospital setting, they would have to be approved for use at the Food and Drug and at the level of the Ministry of Health, and usually would undergo rigorous testing. Of course, and I always emphasize, there is a downside that natural drugs do not imply safety for all, and there may be interactions with some of the medications which would be prescribed by a doctor. The evidence is rising. A simple drug such as aspirin, would you believe, was derived from the bark of the willow tree. So many of the medications in mainstream medicine have actually had origins in terms of herbal or plant material. So, but safety, tolerability, efficacy, and an appropriate price, or STEP is a good acronym when we're talking about drugs. Good point again. Our next caller hails from Oropon. Good evening and welcome to our show.
Hi, Dr. Knight.
Thank you for being part of our family this evening.
Right, I want to ask a question. What happened? Sometimes my scratches me, right? And when it scratches, it brings something up, some little hives. In a long time, it's like this mad blood. So it comes up on my skin and then it goes back down. What do you think causes that?
Thank you very much. And that's a very common clinical conundrum, because I think the person who will have problems with his skin often finds himself or herself a medical orphan. You're going by a family doctor, a dermatologist or skin specialist, sometimes someone who deals with allergies, and you're trying to find a reason for this so-called hives in which there may be red, raised lesions throughout the skin that tend to come and go. Of course, the simple assumption is that it may be due to perhaps something in the environment that one may be allergic to, but it's important to do some basic blood investigations, such as your complete blood count. Persons who have a low blood count may find that there may be rashes of this type, the so-called mad blood, as you mentioned on your call. Sometimes a kidney function, liver, thyroid function test may form a part of your initial investigations. There may be immune-mediated problems. If you have antibodies which are attacking your skin, your doctor particularly may be interested in some of the classic problems such as lupus. There are allergy testing that would be performed in various labs. Are you allergic to pollen, pets, certain foods such as cow's milk protein, nuts, shellfish, some of the basic commonly used food and drink that may create reactions. And don't underestimate the role for stress. The mind, body, and skin are so closely linked when we think about it that emotional stress will also increase the chance for having these problems affecting the skin. So it's easy to use steroids or antihistamines, but perhaps it's difficult, devilishly slow, to find the underlying cause. Basic blood tests, have a chat with your family doctor if a dermatologist or an allergy specialist is required, and then some basic panels may be part of your initial therapeutic management. What a great question, because it's so common and it's tricky to treat. As we head to Central Trinidad, as Warrenville is on the line, good evening and welcome to our show.
Good evening.
Thank you for joining us, ma'am. Welcome.
Doc, I have a cold. I get a virus recently.
I'm sorry to hear
and it
that.
leaves me with a cold.
Yes.
But no matter what I take, it's not helping me. I went by the doctor and they're not doing nothing not going on.
Yes, ma'am.
To stop it. But my son got me pregnant this evening and tell me that I could contract pneumonia.
Mm-hmm. Thank you very much for taking the time to call in. And one of the disclaimers on the show, of course, I'm not attempting to diagnose, but just to guide you in the right direction. Because if you're having persistent symptoms after a virus, there is the possibility that it may have evolved into a secondary problem. So your son is right that there is a chance of something bacterial. Although we may start with a virus, you don't need antibiotics for a fever, a runny nose, some sniffles, just some fluids, rest, tender loving care, and paracetamol may do the trick. But if you're having a cough with very mucky sputum, you're bringing up blood. If you're having fever, chills, trembling, persistent for perhaps more than a week from the onset of symptoms, have a chat with your doctor. If there is what we call a secondary bacterial infection, your doctors may want to consider then the use of antibiotics, a chest x-ray if these are particularly worrying, and even a blood test to look at your white cell count and some inflammatory markers to determine if there are internal issues that linger. And I'll tell you that during COVID-19, persons found that a low dose of steroids was found to be very useful as an anti-inflammatory for those who had a lingering cough after the initial onslaught of the virus. So the fever, sore throat might have improved, but that persistent cough for perhaps weeks following it got better with steroids, and particularly those individuals who had to be hospitalized if you were on oxygen, admitted to intensive care. The use of steroids during the COVID-19 pandemic actually saved lives, and it was found to do so globally, inclusive of Trinidad and Tobago. What a program this evening. And as we say, parting is always such sweet sorrow. We'd like to close with a quote from Seneca. We are more often frightened than hurt, and we suffer more from imagination than in reality. Isn't that so true about life? We are more often frightened than hurt and suffer more from imagination. I think he understood something that modern medicine sees every day. Fear itself can become a form of suffering. Many people spend enormous emotional energy worrying about illnesses that may never develop, symptoms that turn out to be harmless, or worst-case scenarios that exist mainly in the mind. This does not mean that fears are foolish. Fear is deeply human. Fear protects us. But unchecked fear, when you think about it, cortisol and adrenaline that starts surging, can quietly damage your mental and physical health. They raise those stress hormones, worsening sleep. They elevate your blood pressure, and they steal your peace long before any disease appears. Thank you for trusting me to walk beside you each week, in your homes and in your hearts. To my team behind the lens, to the selfless Neela and baby Daniel, and to you, our viewers, stay strong, stay curious, and never stop choosing kindness. A very special birthday greeting goes out to someone who brings calm to chaos, kindness to medicine, and warmth to every room she enters. Neela, thank you for your compassion, your wisdom, and your grace. Blessings on May the 25th. And to all of us, rest, reflect, love deeply. God bless you. We'll see you next time on Ask the Doctor.
Ask the Doctor is brought to you in part by